Okay, I'm starting my week 5 patient encounter. This is my blank sheet of paper.
Hello.
Miss Cairns?
Yes.
Hi, I'm Glenn Adams. I'm a physician assistant and student here to take care of you today.
Nice to
This
meet
is
you.
me washing my hands. Hey, how are you?
Hi.
Is it okay if I take just a couple minutes to write some stuff down so I
Yeah,
can
of
jot
course.
everything right? Alrighty, Miss Cairns. So what brings you in today?
I'm having some chest pain.
Okay. When did you first notice this chest pain?
It's been pretty consistent for the last, I would say like 3 weeks. It hasn't been like super painful, but in the last few days it's been unbearable.
Okay. And when you say the last few days, how many days would you say?
About 3.
3 days. And since you've noticed it being unbearable in the last 3 days, has it been constantly unbearable?
It's pretty bad later at night, I would say.
Okay. But you're pretty much aware of it throughout the whole day?
Right, yeah.
Okay. And can you show me where in your chest you're getting it?
It's right about here.
Okay. Alright. And can you characterize that chest pain for me?
It feels like someone's sitting on top of me.
Okay.
And I have trouble taking a full deep breath.
That's scary. I'm sorry you had to deal with that.
Yeah.
Okay. And with the chest pain that you noticed, especially in the last 3 days, have you noticed any other symptoms?
No, I would say no. It's pretty much concentrated right in that area.
Okay. And does anything make it worse?
I would say when I'm super overwhelmed, I have a hard time catching my breath. And that's when I notice it more.
Okay.
But as far as like the being able to take a deep breath, it's pretty much steady.
Okay. But when you're super overwhelmed, it's like you can't
It's
catch
really
it.
tight.
Yeah.
Mm-hmm.
Okay. And does anything make it better?
It eventually just kind of goes away. But then again, it's just like a less intense pain that I'm feeling. I wouldn't say it ever just goes away.
Okay. It might just get like fluctuate in intensity.
Yeah.
Okay. And you said you mostly feel it right here. Does it radiate anywhere?
No.
Okay. And I know you said that you feel it most when you get super overwhelmed. You feel like you can't catch your breath. Are there any other patterns you've noticed?
No. Pretty much just like if I'm very stressed, or if I'm having a stressful week.
Okay. And did you say it gets worse at night?
Right, yeah.
And can you tell me a little bit more about how it gets worse at night?
I don't know if it's because I'm laying down and my airway is affected differently, but that's just when I notice it more. And I find that I have to sit up when I'm trying to go to sleep just to be able to breathe.
Yeah. Wow. Okay. So in terms of the chest pain, especially the last 3 days, if you had to rate it on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you've ever felt, where would you put that?
I put it like an 8 or a 9.
Okay. And in terms of the night versus most of the day?
Probably a 9.
At night.
Mm-hmm.
And then an 8 or a 9 during the day.
Well, I guess like during the day it's more of like a 5 or a 6.
Okay. Okay. And have you had any previous episodes of this?
No.
Okay. Now I'm going to ask you a lot of questions, yes or no questions. If they're yeses, we'll follow up on them. And so, yeah. So I know you said you have chest pain, and do you feel it at rest? Like you're just sitting there and you feel the chest pain? Do you feel it on exertion?
Yes.
Does it get worse with exertion?
Yeah.
Okay. Do you have a shortness of breath without the chest pain?
Mm-hmm.
Can you tell me more about that?
I just feel like I can never fully inhale and exhale.
Okay.
So even if I'm not having that tight feeling, like during the day when I'm like being conscious of it and I'm trying to take that deep breath, I'm unable to.
Okay. And do you have the shortness of breath? So you have the shortness of breath with and without the chest pain, right? Okay. Do you get a shortness of breath on exertion that's abnormal?
No.
Have you been nauseous or vomiting?
No.
Have you been sweating abnormally?
No.
Do you have a cough?
No.
Okay. I know you said that when you lay down at night, it gets worse. Do you feel like you are short of breath when you're laying down?
Mm-hmm.
And so you said that you would prefer to sleep sitting up.
I usually like sit up to try and like get that deep breath in and like try and like calm myself down, and then I'm able to lay back.
So are you using any pillows to prop yourself up to sleep?
No.
Okay. When you're asleep, lying down, do you wake up at all short of breath, like slops out of your sleep?
No.
Okay. Have you felt any palpitations in your heart?
Yes, a few times.
Can you describe them to me?
But that's been pretty consistent like throughout my life. Just randomly, I'll get the little.
Okay.
But it just passes. It's
not in relation to this.
Yeah.
Okay. Have you noticed any swelling in your legs?
No.
Have you felt like you were gonna pass out?
No.
Have you passed out?
Mm-mm.
Do you have leg pain?
No.
What about when you're exercising or walking around? Do you get cramps in your legs that are abnormal?
No.
Have you noticed color changes in your legs?
No.
What about lack of hair growth on your legs? Do you have any non-healing lesions?
Mm-mm.
What about abnormal bruising?
Mm-mm.
Numbness in your legs?
Mm-mm.
Your arms? Have you felt dizzy?
Mm-mm.
And no swelling in your legs. Have you noticed any temperature changes in your legs?
No.
Okay. Last set of questions. Have you had a fever in relation to this chest pain?
No.
What about chills?
No.
Fatigue?
No.
Have you had an overall sense of unwellness?
Unwellness?
Yeah, like discomfort.
Yes.
What about a change in appetite?
Slightly.
Can you tell me more about that?
Yeah, just decreased. Like I'm not eating as much as I normally would.
Your chest is hurting, you're not as hungry.
Mhm.
Makes sense. Do you have a generalized feeling of weakness?
No, I wouldn't say so.
And have you had weight changes?
No.
Alrighty. Do you have any previous medical diagnoses that I should know about?
No.
No? Have you been hospitalized ever?
I had my adenoids and my wisdom teeth removed.
Okay.
But other than that, no.
What year were those surgeries?
My adenoids were, I think, 2002, and my wisdom teeth were 2015.
Okay. And no other surgeries?
Correct.
Are you up to date on your immunizations?
Yes.
Did you get your flu shot last season?
No.
Are you on any medication?
No.
Anything vitamin, herbal, supplement?
Mm-mm.
Do you have any allergies?
No.
Nothing medical,
Mm-mm.
food,
Mm-mm.
seasonal. Alrighty. Now I'm going to ask you some questions about your family history. Are both your parents still alive?
Yes.
How old are they?
My mom is 52 and my dad is 55.
Okay. Do you have any kids?
No.
Kids. What about siblings?
Yes, I have 2.
Can you tell me about them?
My brother is 24. My sister is 30.
Okay, cool. Alright, in terms of you and the family we just established, so mom, dad, brother, and sister, has anyone been diagnosed with high blood pressure?
No.
What about diabetes?
No.
High cholesterol?
No.
Does anyone have heart disease?
No.
Has anyone had a heart attack?
No.
Has anyone had a stroke?
No.
What about cancer?
No.
Healthy group.
Yes,
Good
we
for
are.
y'all.
Take pride in that.
Yeah, that's awesome. Alright, now I'm going to ask you some questions about what we call your social history. I just want to preface this with everything I'm asking you is just to be able to take care of you better. There's no judgment here.
Okay.
Alrighty. Do you use any tobacco products?
Occasionally.
Can you tell me about that?
I'll smoke a cigarette or 2 when I'm drinking.
Okay. So like a social cigarette.
Right. Social pack.
How many years have you been doing that?
About 5.
5 years. And when you are having a social cigarette, how many times a week is that happening?
I'd say like I would smoke a cigarette once every 2 weeks. It's nothing.
Okay.
Like by no means a habit.
Do you consume alcohol?
Yes.
Can you tell me about that?
I would say like 4 days out of the week.
And how many drinks?
On average like 3.
What you drinking?
What am I drinking?
Yeah.
Mostly like vodka.
Okay.
Maybe a glass of wine.
So like a mixed drink or vodka on the rocks?
A mixed drink.
Do you do any recreational drugs?
No.
Can you tell me about your diet?
Yeah, so I don't eat meat products. I lay low on the dairy. I mostly eat fish, no soda, pretty much just water and coffee.
Do you monitor your salt intake?
No.
Alrighty. Do you exercise?
Yes.
Can you tell me about that?
I'd say like 4 days out of the week.
Alrighty. And what are you doing?
Just like at-home workouts.
Cool. Alrighty. Are you employed?
Yes.
What do you do?
I work at a restaurant.
Okay. And do you have insurance?
Yes.
Can you afford your medications if you're prescribed stuff typically?
Mm-hmm.
Alrighty. And what's your living situation?
I have 2 roommates. We live in a townhouse.
Do you feel safe at home?
Yes.
And are you sexually active?
Yes.
Do you use protection?
No.
Alrighty. And have you been screened for sexually transmitted diseases?
No.
Alright, Miss Karen. So just to make sure I have this correct, about 3 weeks ago you noticed chest pain. on and off, but for the past 3 days it's been constant, and it's like 5 or 6 during the day, 9 or 10 at night, 9 right at
9,
night.
yeah.
It's worse when you lie down. You're not sleeping with pillows behind you, but sometimes you're lying down and you feel like you need to sit up to take a deep breath. The pain, it feels like you have tightness, someone's sitting on your chest, you can't catch a breath. It's worse when you're feeling super overwhelmed or having a hard week. And sometimes it'll fluctuate through the day, get better on its own. Is there anything else I need to know?
That's it, I think.
Alrighty. Thanks
you.
for talking with me.
Thank you.